As parents, you play an important role in your child's surgical experience. There are several things that you can do before leaving home that will help ensure the best possible experience for your child. Stop any herbal supplements and vitamins at least 10 days before surgery. Follow the directions you receive on whether your child may take their regularly scheduled medications. Follow the directions about when your child can no longer eat or drink before the surgery. This includes gum or hard candy. The operation may be canceled if your child has anything to eat or drink after the appointed time. These limits are necessary to reduce side effects from anesthesia. Tell us if your child is feeling sick the morning of surgery or has been exposed to a contagious illness like chickenpox. On the day of surgery, please bring your child's current list of medications and dosages, any paperwork needed from your child's doctor, and your insurance card. You may also bring the following comfort items to be taken into the operating room with your child: a freshly washed blanket, a freshly washed stuffed animal, and a pacifier. Patients should not wear jewelry, makeup, contact lenses, nail polish, hair beads, metal clips, or any piercings. Lockers are also available to store personal items, but valuables should stay at home. When coming to the GOJO Outpatient Surgery Center in the K Jewelers Pavilion, please park at the P2 Exchange Street parking deck. Bring your parking ticket with you. Parking will cost $1 after we validate your ticket. Follow the covered walkway to the building and turn left to enter the surgery center. Check in at the registration desk. You and your child will be taken to a pre-surgery room to be registered. There, your child will be given pajamas to wear. Next, a nurse will perform an assessment, which includes taking your child's pulse rate, blood pressure, height, and weight. A child life specialist who helps children and families cope with the emotional aspects of surgery will be available to help your child feel more comfortable by offering hands-on play and interaction. This may include choosing a flavor to smell inside his or her anesthesia mask. The pediatric anesthesiologist, who is specially trained to give anesthetics and pain-reducing medicines, will meet with you to collect additional information about your child's health in order to make a special anesthetic plan for your child. The pediatric anesthesiologist works with many age groups, including infants, children, and teens. They will tell you about possible side effects and answer your questions about anesthesia. When it is time for surgery, a nurse will escort your child to the operating room. You can wait for your child in the family waiting area. Please stop at the hostess desk to check in. There are different types of anesthesia. Most commonly, your child will receive a general anesthesia. This type of anesthesia can be breathed in through a mask or given through an IV. Other types of anesthesia include local and regional anesthesia, nerve blocks, and sedation. If your anesthesiologist feels these would benefit your child, they will speak with you about these options the day of surgery. While under general anesthesia, your child will not feel anything during the operation. The anesthesiologist will use a combination of medications to help block the memory of surgery, relieve pain, and relax muscles. During the entire procedure, a member of the anesthesia care team will monitor your child's heart rate, blood pressure, body temperature, oxygen, and anesthesia levels. When the surgery is over, your child will be taken to the recovery area, where they will be closely monitored by specially trained nursing staff. Then the surgeon will meet with you in a consult room. 2 adults may then go to the recovery area to see your child. Some children will be very drowsy after surgery, while others will be wide awake. Pain medicine may also be given to help keep your child as comfortable as possible. Your child will be closely monitored as the anesthesia wears off. Sometimes the anesthesiologist may admit your child for extra monitoring if any serious symptoms arise. When your child is ready to leave the hospital, you will receive homegoing instructions as well as help to safely get you on your way. If you need additional information or have any other questions, please visit our website or call the surgery department. We make every effort to help your child have the best possible experience. Thank you for entrusting your child's care to Akron Children's Hospital.